I think that the biggest impacts of social media have really been related to both timeliness and connectivity. On a research or clinical side, with Twitter, you can hear about the latest or late-breaking clinical trials at a scientific meeting. And connectivity, it allows patients not only to interact direct with researchers, but also with clinicians and the hospital itself.
Every morning, I actually look at my Twitter feed and I follow the American Heart Association, the American College of Cardiology, and a number of other cardiovascular research sites. I'm able to catch up with the latest research and then share it with my patients and utilize that data in my daily practice of cardiology.
Twitter has accelerated the speed at which information is spread. And so in the past, we might wait for weeks or months before seeing a paper. But now, within 24, 48 hours of something that is impactful, the entire community is discussing it.
I follow what interests my colleagues scientifically, and if they tweet about a very interesting paper, I'm more likely to read about that. And it's part of sharing in the community and keeping in touch with your scientific friends.
With respect to the role of Twitter, as I see it, it will continue to be perhaps the most disruptive and novel way to get new ideas out in the cardiovascular medicine space.
I think social media are also an opportunity to be able to engage directly between the clinical community and the patient care community so that patients can become more active participants in their care.
It's allowed rapid, real-time access to investigators and to other thought leaders who weigh in on particular subjects of interest that are cutting edge.
Ideally, I would love to see social media as a forum for physicians, cardiologists to engage our patients in their own care. Empowering patients to really understand the diseases that affect them and engage in their own treatment would be a wonderful use of social media.
And it's a potential resource that we can really leverage to try to understand medicine at a very fundamental level and healthcare delivery at a very fundamental level. So I think there's a lot of exciting work being done in this area, and really to try to understand how we can leverage technology to better deliver healthcare.